Hi, we are here to discuss the results of Abby's assessment. Abby is a 14-year-old female who lives at home with her mother, father, twin brother, and younger brother. She was born at 30 months gestation and remained in the neonatal ICU for 2 months after birth due to prematurity. Shortly after birth, Abby was diagnosed with Down syndrome. She also has a diagnosis of atrioventricular valve syndrome and had open heart surgery at age 3 to repair her AV valve. Abby has had chronic ear issues and 2 sets of tubes. She has a mild hearing loss but does not need hearing aids. Abby does wear glasses to correct vision issues. Abby was initially assessed through Project Run Early Intervention Services to look at concerns regarding overall development. She received speech, occupational, and physical therapy, as well as specialized instruction through Project Run prior to her 3rd birthday. She was then referred to the school system by her parents and Project Run. At that time, Abby qualified for special education and related services under the eligibility ruling of developmentally delayed and began participating in a preschool program for other students with special needs. She continued receiving speech therapy, occupational therapy, physical therapy, and specialized instruction. Upon reevaluation prior to turning 10 years old, Abby was assessed to obtain information regarding her present level of functioning and to determine a more appropriate eligibility ruling. Abby's speech and language skills were assessed as part of the comprehensive assessment. The receptive and expressive one-word picture vocabulary tests, also known as the ROWPVT and the EOWPVT, were administered to get a measure of receptive vocabulary, which measures a person's ability to understand words spoken to them, as well as expressive vocabulary, in which a person uses words to produce meaningful speech. These measures have implications regarding a person's cognition, language, and academic performance. Abby was asked to point to pictures of given vocabulary on the receptive portion and give the names of picture vocabulary on the expressive portion. This assessment may be given to individuals ages 2 through 95 years. On this assessment, Abby earned a standard score of 57 on the ROWPVT and less than 55 on the EOWPVT. Scores of 85 to 115 are considered to be within the average range. This puts Abby in the very low range of functioning with both receptive and expressive skills. Scores in this range fall below the first percentile in both areas, meaning she scored the same or better than less than 1% of the population of individuals tested. This gives an age equivalent of 4 years, 5 months in receptive vocabulary and an age equivalent of 2 years and 10 months in expressive vocabulary. This means she is performing at about the same level as children of those ages in each area. Results of these assessments reveal that Abby has strengths in receptive vocabulary, or what she is able to understand, and weaknesses in expressive vocabulary, or what she is able to express. Articulation skills refers to how a person produces their speech sounds and was also assessed. The Goldman-Fristow test of articulation, 2nd edition, was administered and Abby had to name pictures of targeting certain speech sounds. This test may be given to individuals ages 2 through 21. Abby had errors on 31 of the stimulus items presented, which resulted in a standard score of 56 and a percentile of less than 1. This means she scored the same or better than less than 1% of the population of students tested. These results give an age equivalent of 3 years. To assess cognitive skills, the Differential Ability Scale 2nd edition, Early Years Battery, or DOS-2, was given to assess cognitive abilities related to learning. This test may be given to children ages 2 years 6 months through 17 years 11 months. Standard scores between 85 and 115 are considered to be within the average range of functioning. Abby's full scale standard score was 54, which falls within the very low range of intellectual functioning. On the verbal portion, she earned a standard score of 50, which fell in the very low range of functioning. Her nonverbal standard score was 76, falling in the low range of functioning. Her spatial standard score was 57, which also fell within the very low range of functioning. This assessment indicated that her verbal and nonverbal abilities are not evenly developed and that Abby shows strengths in her nonverbal abilities. The Adaptive Behavior Assessment System 2nd Edition was also given to assess performance on the day-to-day activities needed to take care of oneself and get along with others. This assessment is designed for individuals ages birth to 89 years and is completed with the use of rating scales by people familiar with the behavior of the individual student. Abby's mother and teacher were both given rating scales in order to gauge Abby's adaptive behavior skills. The overall standard score on the parent rating scale was 41, and the standard score on the teacher rating scale was 40. This put Abby in the extremely low range of functioning and adaptive skills when compared to same-age peers. According to results, Abby showed strengths in social adaptive skills and weaknesses in practical adaptive skills. According to all of the assessment data, it appears that Abby has significant delays in adaptive, social, communication, and cognitive skills. Her overall intellectual functioning is in the very low range of functioning, and adaptive skills are in the extremely low range of functioning. Language and articulation skills also make interpreting and expressing both speech and language more difficult for Abby. Abby's overall strengths are in the area of nonverbal skills, and her greatest area of need is in expressive communication. Based on the level of intellectual ability and adaptive ability, Abby meets criteria to receive special education and related services under the eligibility category of intellectually disabled. Therefore, Abby is able to receive specialized instruction and language therapy services as part of this eligibility category. In addition, Abby's articulation deficits make her eligible for a secondary eligibility of language speech for articulation therapy services.